guys and welcome to my channel. My name is Dr Minnie and I'm a veterinarian, and today I would really like to talk to you about five things that your veterinarian really wants you to know. I hope that these are going to give you a little bit more of an insight into the vet's mind, this weird and wonderful place up here, and also provide you with some tips and things you might not have thought about to help improve the lives of your pets. So let's get to it. The first thing your veterinarian wants you to know is that we really do want you to brush your dog's teeth. I've had clients think I was joking when I requested this during a routine health visit, but I'm not messing about. I really do think that dental disease is one of the most underappreciated quality of life issues in our older patients, and a lot of it would have been preventable with good dental hygiene, so regular brushing, and also routine dental work as recommended by your vet. Just remember, we have to brush our teeth twice a day, this is a PSA for humans too, and we also have to get regular scale and polishes every sort of 3 to 5 years depending on the status of our teeth. So our dogs really aren't any different. And you might hear some people say, well, dogs that are fed with bones or dogs that are raw fed, they don't have problems. Wolves don't have problems in the wild. This is absolutely untrue. Wild animals actually suffer a lot with periodontal disease and dental pathology in general. In a really cool study on 392 wild wolves in Europe, 55% of the carcasses studied had periodontal pathology. So periodontal disease is basically where there is sort of tooth loss or tooth resorption or gum problems as a result of advanced bacterial infiltration. So periodontal disease starts with gingivitis. Gingivitis is inflammation of the gum, and that can be prevented by good brushing, because gingivitis is the body's response to bacteria on the teeth. So if you're brushing off that bacterial biofilm or the plaque with the mechanical abrasion of the toothbrush, then you'll stop that forming gingivitis, and then you'll eventually stop the follow-up of periodontitis, which is painful and does result in nasty teeth problems. So a diet of raw bones or a raw, a whole prey diet is actually not sufficient to be getting rid of any problems. But it's also important to remember that ultimately dogs aren't wolves. That's where they came from, but it certainly is not where they are now. And especially if you have a dog that has a smaller face or a shorter snout, then they are more prone to dental disease. Their teeth are often crowded and slightly inappropriately placed in their mouth, God bless them. So they require an even more vigilant approach to dental disease. So please brush your dog's teeth. I promise you it will make such a difference to their quality of life, and your vet will be so pleased. I'm going to link some useful resources in the comment box about how to get started brushing your dog's teeth. Number 2. That if we put a muzzle on your dog in the vets, it is not that we think they're a bad dog or an aggressive dog, and it's not a poor reflection on you, so please don't be anxious about it. If we put a muzzle on your dog, we're not trying to embarrass you or upset you. We just know that dogs are incredible animals and literally made out of pure gold 99% of the time, but ultimately they are still animals, and if they're painful or if they're stressed and they're in a weird environment and just generally they're upset, it's very possible that they could do something they don't mean to do, and they could snap or they could bite, and that's not a risk that we should be taking. Even if you think your dog would never do that, I understand that, and they probably wouldn't, but also it's important that you understand that we see maybe 40 dogs a day, and it's not really a risk we can afford to be taking every time. We understand dog behaviour very well, so just trust us when we say that we're doing the best for the pet and for us in that time. And a follow on from this is actually to please consider muzzle training your dog, because if they do need a muzzle on in their life at some point, which almost every dog will need in some capacity at some stage, then it helps to make it such a less weird experience for them. Because I know a lot of people are stressed by the thought of the muzzle because their dog is stressed by the thought of the muzzle, but I genuinely think all dogs should be prepared to wear one. So muzzle training can be a really valuable addition to your training regime as a puppy, and even older dogs can learn it too. I just think it's a really good way to set your dog up for success in all areas, so they're never going to find anything that stresses them out. So if you can muzzle train them, then you'll make everyone's life so much easier, including theirs. Number 3. When you're in the waiting room of your vet clinic, even though your dog may love cats and be a really friendly dog, please don't let them approach the cat baskets. I can't tell you how many cats definitely don't appreciate being approached by a dog when they're already sort of in a confined space and already quite stressed. So although your dog means no harm by it, and we know that, please just make sure you're keeping them away from them, because I can absolutely tell you that I know when a cat's been stressed in the waiting room, because it makes it about 90 times harder to handle them, and you're sort of, they're becoming liquid in your arms and they're jumping out and they're just trying to get away from you, so it makes the examination that you then have with them a lot harder to do well, and the cat is stressed. So for our sakes and for the cats, please don't let your dog be sniffing around baskets when they're in the room, even though I know they just want to see what's going on. Number 4. No matter how awesome your cat or small furry is, please do not bring them in your arms or in a cardboard box without a lid. It makes us so stressed as vets when we see that someone's in the waiting room with just like some sort of cereal box or something, or they've just got their cats kind of chilling in their arms. I say this because It doesn't really matter how well behaved your cat is or how chill your cat is, there could always be that one thing in this weird new environment that just sends them over the edge. Unfortunately, I know of a colleague who had that happen at their practice, and the owner brought their cat in their arms and everything was fine up until they went them out to the car park after the consultation, and it just so happened that a dog barked right at the wrong moment and the cat freaking scarpered out that box and was lost for like 3 days. So just don't put yourself in that risk, no matter how great your cat is or how well behaved your hamster is. Make sure they're in a secure container, preferably an actual cat box or a small animal box. It's just not worth the risk, and it's not worth stressing your veterinarian out. So please just make sure you have an appropriate carrier for your animal when you bring them into the vet. And number 5, if your animal has ingested something potentially toxic that may or may not have been a human recreational drug, please just tell us. We honestly do not give two shits that they ate, you know, a little bit of the brownie that you made for your marijuana party that weekend, you know, or that they licked some cocaine off the side of your crack fest. We really don't care. We just need to know so that we can treat the animal better. We're not law enforcement. We're not going to report you. We have no interest in what you're up to, as long as it's between consenting adults. We just really want to know that the animal is going to be okay, because we can identify what it was and we can treat it better. So I know a lot of stories of clients being reluctant to share with their vet what their animal has eaten, and then it becomes obviously impossible for us to work out what we need to do. So do not be embarrassed. Do not be worried that we're going to tell on you, because we're really not going to do that. Just make sure you tell us honestly and openly when they ate it, what they ate, and how much they might have eaten, and then we'll do the rest, okay? So just work with us. We're not going to report you. We care about the animal more than we care about what you're up to on a Saturday night. So that was a little look into a veterinarian's mind. I mean, there's a whole lot more bubbling away in there, but just for now I thought I'd stick to 5. If you learned something new or picked up something cool, please pop a little comment in the description below. It really helps these videos to reach as many people as possible. Also, give it a thumbs up, and please subscribe to my channel. I'm going to be posting videos hopefully every Sunday and every Wednesday, so I do a variety of topics. If you're a new grad, I do actually do a few sort of informational topics to help with new grad skills, but if you're not any of those, I'm also just going to be sharing lots of different tips and tricks for your pet's well-being, general insights into the veterinary world, and I'll also be talking about my new career as I'm starting as a sea turtle vet in the Maldives. So if you like turtles and animals and vet stuff and sunshine and beaches, maybe consider subscribing, and I'm going to be keeping all of you guys posted on my future adventures. So yeah, I hope you enjoyed that. Please let me know if there's anything you'd like me to cover, and I'll see you next time. I promise I'm not sponsored, it's just the only thing that you can see that makes this scrub shop look any different. Although Cherokee, if you do want to sponsor me, I'll take a sponsor. I always need scrubs.